Lancet commissions look at areas that are either neglected or understudied. And although you couldn't argue that digital health or artificial intelligence are neglected, they probably are understudied when we look at the quantity and quality of research which is published in peer-reviewed journals, when we look at where that research is focused more in high-income countries than in lower middle-income countries, and also when you consider some of the shortcomings when thinking about data safety, privacy and child protection. What the Lancet Financial Times Commission, Growing Up in a Digital World 2030, attempts to do is to put in place some of the reassurances for regulation and governance that are required to make the rollout of these technologies both equitable and safe. All Lancet commissions are intersectoral and multidisciplinary, and that's one of the ways that the Lancet Commissions delivers this kind of transformational thought. Looking at this specific field, digital health and artificial intelligence, it's clear that it's even more broader than the Lancet readership. And so that's where this partnership with the Financial Times comes in. We can see that in partnering with the Financial Times, we can not only reach out to their audience for their expertise, but also reach out to them in delivering the messages, the recommendations of the Commission and turning them into action. So the Financial Times are going to have a role in both outreach and communications. So their outreach role will be to arrange a number of convenings with industry figures. They'll also do a communication role with a microsite, so interested parties from their community can follow the work of the Commission. Lancet commissions all have a very strict conflict of interest policy, so it wouldn't be possible for anyone who had a kind of industry role to play a role as a commissioner in this work. However, by engaging and partnering with the Financial Times, it enables the Commission to draw on the expertise within that sector. Lancet commissions are always peer-reviewed. Firstly, it's really important that they're subject to independent external scrutiny, and also we know that peer review improves the quality of any publication, and commissions are no exception. The first Commissioners' meeting will be at the end of October in Berlin. Really looking forward to getting the chairs and the Commissioners together for the first time. Although the Commissioner has a statement of intent, which was published in the Lancet, it's really not until the Commissioners and the co-chairs get together that we really know exactly what the Commissioners will look at, how they'll tackle it, what the recommendations will be. So we're really looking forward to that first meeting, to finding out how the Commissioners approach this work.